Hi, my name is Amanda Ramos, and I'm one of the GYN Oncology Fellows at Mass General Hospital. There are a variety of reasons why I chose MGH for fellowship training. When I was interviewing for fellowship, I knew that I wanted to be at a hospital that was surgically diverse with high surgical and clinical volume. It was important for me to find a place where I was going to be treated as a colleague and that everyone had the same mission of putting the needs of the patients first. As soon as I matched at MGH for fellowship, I was taken in as a family member by the Division of GYN Oncology. All of my soon-to-be attendings and co-fellows reached out to me, making me feel welcome and supported for the training ahead. Ultimately, MGH is one of the most well-rounded fellowship programs in the nation, with excellent training in laparoscopic, robotic, and open surgery, and just as importantly, in how to comprehensively take care of patients with gynecologic malignancies. Here we are trained to administer chemotherapy, manage the complications, and make difficult decisions with our patients, including end-of-life care. It was evident when I came here that I was going to be well-trained in all aspects of oncologic care, backed by a supportive attending group who take your opinions seriously and treat you like one of them. When I was in the middle of it, I could never picture what the completion of my training would look like after so many years of working towards the goal of becoming a GYN oncologist. There were times when I thought I wouldn't make it. But every step of the way, my GYN oncology family was behind me. I feel so incredibly well trained. I know that I can manage any clinical scenario that comes my way, and I know that if I need help, I can always call my colleagues here. They will help me with whatever I need. MGH has truly made me into a complete doctor with a continuing curiosity. If I had to do it all over again, I would. I would come here because here you will receive the most vigorous surgical and clinical training by physicians who want to make you into the best doctor possible. People here care that you do well so that you will provide the best medical care possible to your patients.
Hi, my name's Lydia. I'm one of the maternal-fetal medicine fellows. I chose Mass General because of the people. From the moment I arrived on my interview day, I was struck by how warm and welcoming and genuine everyone was. And I was equally impressed by the breadth and depth of experience of the MFM faculty. I was also struck by how collegial and respectful everyone treated each other. It was clear to me that the faculty view and treat their fellows as colleagues, not just trainees. Mass General is the place where I finally became an MFM, which was my goal since the first year of med school. Now entering my third year, I can see that I've had so many opportunities to develop the skills I set out to develop, like cerclages and forceps, amnios, and also to learn things I never anticipated learning, such as critical care obstetrics in the times of COVID and diving headfirst into the development of a COVID pregnancy biorepository. Mass General is an amazing place to take on new clinical and research ventures, and the OBGYN department has such great relationships with faculty from other divisions across the hospital that makes the fellowship learning experience even richer. I spent many years at a different institution prior to Mass General for my academic and medical training, and I'm amazed by how quickly Mass General has come to feel like my home. I'm very grateful for being welcomed here with open arms and for the incredible mentors I've found here.
I'm Marcus. I'm the 30-year fellow at the Female Pelvic Medicine and Reconstructive Surgery Fellowship here at Mass General Hospital. Being part of Mass General Hospital is to become part of a legacy that goes way back, and Mass General Hospital was one of the first general hospitals in North America. This long-standing history creates a university of opportunities for research and training. I have found a community deeply committed to advance equitable, high-value, and compassionate care to patients. All this together, it made it very easy to choose Mass General for my fellowship training.
I'm Young Woo, the second-year fellow at Female Pelvic Medicine Reconstructive Surgery Fellowship at Mass General Hospital. When you choose MGH, you're choosing to be a part of a legacy. When I met my now mentors on my interview day, its grand legacy of MGH was no longer the shining part of the program. My mentors are some of the most down-to-earth people I've ever met, and they genuinely are interested in my education and well-being, which stands true to today. People understand that MGH is where it is today because they continue to strive to do better every day. Everyone that I've met here are so proud to be part of the community, which naturally creates a positive and supportive working environment. The expectation has been high, which is actually motivational as it comes with amazing level of support and commitment to your education. The amount of resources available for me to flourish in my learning is beyond what I expected. Also, more recently, throughout the COVID-19 pandemic, MGH again shined with its strong leadership. Their transparency with the situation that was unknown to all of us and their effort to keep open communication of their concerns helped me stay focused on my job and patient care and my education.
Hello, my name is Jennifer Hsu, and I'm a fellow at Mass General Hospital in reproductive endocrinology and infertility. So why did I choose MGH? When I was looking for a fellowship in reproductive endocrinology and infertility, it was really important to me to find a program with strong mentorship opportunities, as well as a collegial learning environment where I'd be both a learner and a teacher. I knew that every REI program in the country trains its fellows really well in the care of couples with infertility. However, I felt that MGH additionally had many other things to offer, including advanced reproductive surgery, bioethics, endocrinology, and a wealth of research opportunities ranging from basic science and reproductive biology to epidemiology. I was also excited to live in the city of Boston with its unique history, avid sports scene, cultural events, and world-class restaurants, which are all much easier to experience and take pleasure in outside of the context of a global pandemic, I can assure you. All said, I recognized MGH as a place where I would receive superb, really well-rounded training in the field of REI, and where I would also have much to enjoy and experience outside of the hospital. From the beginning of my fellowship, I felt an immediate connection to my co-fellows and to my attendings, a group of intelligent, hilarious, caring people who've become my family. They've taught me how to take excellent care of patients, and I feel well prepared to take care of complex medical scenarios as they may arise. I'm proud to join the ranks of the countless physician alumni who've trained at MGH, and I know the relationship does not end here with my graduation. I think it's always important to remember that the world of academic OBGYN is really small, and within each subspecialty even smaller, so the people that you meet now, work with, and play with will be your community for a long, long time. The meaningful connections that I've made here with these wonderful people and at this institution have helped me successfully complete my fellowship and secure my first attending job, about which I'm incredibly excited, and I look forward to continuing the MGH legacy in the years to come.